everyone. Woo! When you hear that, you know Michael Henderson, the owner of Tapestry Insurance Group, is in the house. Welcome back. You have been such a long-term client. Thank you so much for that and supporting the show. But I want you to tell everybody why, and I'm going to say it just like from the first day you came on my show, why is every day a Medicare day?
Every day's a Medicare day. I mean, it's, you know, there's people turning 65 every day. There's people that are moving from one municipality or state to another. People retiring. Obviously, most people don't these days retire at 65, and so they might have employer group insurance, you know, until later. And all those things combined add up to there's people every day that need to talk about Medicare.
Yeah,
right?
people always think that it's just
when all those ads are on TV.
Yeah, when they're on like every second.
Yeah,
right?
yeah.
But it's not.
No, you know, that's the I gotta be honest with you, even a lot of agents think that's the busiest time of the year, but we as an organization, you know, we help about 60% of our folks during this time of year, during the rest of the year, and only about 40% during annual enrollment, which is that October through December. And that's because we do recognize that there's a lot of people that need help during the year. You know, people don't retire at the end of the year all the time. It might be, you know,
no, but just because you retire, you have to have, I mean, you got to start looking into Medicare. People, I have to be honest with you, I think people get very excited about getting Medicare.
I am when I get it. I mean, you know, it's with what I pay for insurance. You know, it's the best thing going. Medicare, it's not free. I mean, we do pay into it during our lifetime of work, and there's a small premium for Medicare Part B when you do go onto it. But man, it's so much better and so much cheaper than what we all pay before we turn 65.
Everybody that's turning 65, they all say the same thing to me. I can't wait.
Yeah.
A lot of people think that it's number one, it's free, or that it just happens by itself.
Yeah, so I mean, it kind of used to a little bit more because when the retirement age for Medicare was 65, you know, for Social Security was 65. People would retire, they'd get Medicare, and they'd get Social Security at the same time. So Medicare was somewhat more automatic at 65 then because, you know, not so many people were working past that. Nowadays, though, you need to really apply and make sure that Medicare is going to kick in for you if you don't have insurance when you turn 65. So, you know, about 90 days from when you turn 65, you should reach out to Medicare and Social Security to make sure that your Medicare is going to be active if you need it, even if you're not going to take your Social Security benefits until 67 or later, because you want to make sure you have insurance.
Yeah, absolutely.
Yeah.
Now I want to talk about you for a minute.
Uh-oh.
First of all, Michael is your seniors advocate. You really, truly are. You love what you do. Oh, you are so passionate about it.
You know, I do. It's I don't know. It's a community thing. It's a people thing. I think that we're all in this crazy world together. You know, and we need to help each other navigate things. And one of the things that I've found in insurance, and I used to do group insurance, and I used to do, you know, employer and all this kind of stuff, and I got out of that because it's just so impersonal. What I have found with Medicare is it's just so confusing for people, and so sometimes, believe it or not, people just ignore it. And you know, that's like one of those things, you just hope it goes away if you ignore it.
Yeah, I understand that.
But we need it, you know, especially as we get older, we need health care. And so it's very important for people to understand it, and that's why I love it so much. It's something I take as an educational opportunity, and that's how we work with all of our agents to do that as well.
And I have to tell you, when it comes to persons, that's
persons.
okay to say that right. You are a people person.
I love
you really
it.
Are.
Yeah, it's fun what we do. It's hard what we do as well, but it's fun and rewarding at the same time. And I've said this on the show before, I feel like I volunteer every day, but I'm able to pay my bills. And so it's rewarding in multiple ways, right?
And education, he's all about that.
Yeah.
But also something that you say all the time when you come on the show, and that is that people need to call someone local.
I really believe that. I mean, there's a lot of organizations out there. There's a lot of help out there, but you just don't know who you're talking to unless I don't know, it's that local person. And I'm old school, I'll admit it. I grew up on a ranch in Colorado, and so I like that one-on-one space. I just don't think you're going to get the same service and knowledge with somebody that's in a call center somewhere off in wherever, Neverland. Timbuktu, Florida, which we looked up as a place. You know, you want to talk with somebody local that knows your local plans, that knows maybe the networks and things. We just had a big network change with one of the plans. Actually, just this month, it's going to take effect in a couple months. And people outside this area may not know that, right? They just know the benefits that are put on the screen and from there. So ultimately, yes, long story short, talk to somebody local. We'd prefer it to be us, of course, but if you have a local agent, that's fine. Just make sure you're talking to somebody local.
A lot of people don't realize that there are these local agents like you.
Yeah, you know
that's why the show is great, so they can hear people, so they can hear what's out there.
We can't afford to spend millions of dollars on TV ads like some of these call centers do, and so, you know, people don't know that we exist here locally because they just see all those ads on TV, and so, you know, I'm not saying that they don't know their stuff and they don't know what they're doing, but I just think it's important to have that connection. And also, it's not just getting enrolled in a plan, it's after the fact. What happens when you have a question about a bill?
I was just going to say that.
Yeah. What happens when you have an issue with getting maybe a prior authorization done on a procedure that you need that your doctor wants, and they're running into roadblocks, things like that. Those seem little until you run into them.
Well,
right?
You said that earlier too. We're going to talk about that.
Yeah.
But here's the thing too: medication. Medication changes all the time.
Yeah.
And when that happens, and you go to fill it, and now it's so much money, you don't have somebody to call. You'd be able to call somebody direct.
Yep.
Speak to you and find out how they can help you. That to me is priceless.
Yeah, and there's no, you know, people are fearful that when they talk to somebody, they're gonna get this bill in the mail or something like that.
Yeah, it's a free service.
Yeah, there's no cost to talk to us as agents. We get paid by the insurance carriers if you enroll with us. If you don't, if you're on the right plan, we're not going to pressure you to do anything. It's just about education, and it all comes back around. You may not need a plan. You might be on the right one, but maybe your neighbor needs something, and that's how it works with us.
That's right.
Yeah.
Now, first of all, his phone number is 480-847-0701. He services the entire Southwest. This is a free service to you. We want you to call and leave a message. And that's something that's important too, real quick.
Yeah, let's talk about that. So we're highly governed. I know out there you guys that are over 65 or getting close to it are getting calls inundated right and left. Technically, that's not kosher. It's not okay.
It's not kosher.
It's not okay.
It's not okay.
We're highly regulated. We are not allowed to grab a list of people that are 65 and just start dialing the phone.
Right.
We have to have what's called permission to contact, and so if you just dial and don't leave a message, we don't know who it is, and so we can't, that's not giving us permission to call. So leave a message, you know, say you want to ask a question about Medicare or whatever, and then we can call you back.
So his phone number again, it's 480-847-0701. Now, we talked a little bit about this before you came on, and we're going to continue this conversation after the break, but what people forget about until they need it.
Yeah, you know, there's, obviously, we're talking about Medicare. There are things that Medicare doesn't cover. Original Medicare. You may have a plan like an Advantage plan or something that does give you some coverage, although some of those are changing and it's getting lesser, but dental, vision insurance. Medicare only covers it if it's a medically necessary procedure. So they don't cover dental cleanings, for instance. Things like that. So there are things out there that Medicare doesn't cover you may want to look at as well, just to give yourself peace of mind. Again, it's all about education. We're not pushing anything, but there are things that can help with co-pays, co-insurances, costs, and things like that. Indemnity plans, hospital indemnity. You've got a hospital cost if you go into the hospital on an Advantage plan or on original Medicare, and those costs can add up. You know, there's plans that help offset those costs as well. So there are things that you can add to your Medicare that also give you or can give you some peace of mind.
So somebody's listening and they're saying, "Wow, I didn't know that," and but they might already have. They can call you and you can change that?
Yep, exactly.
Okay,
So
great.
because these plans aren't tied to their Medicare plan. So like a dental, it doesn't matter what Medicare plan you're on. You could change it every year. Not that I advise that, but you could change your medical plan every year, your Medicare plan every year, and keep your dental plan secure. it's a separate plan. So
Mm.
you don't have to worry about what you're enrolling in to make sure you have coverage for this.
But I'll
and
tell you
that.
one thing, you do want the coverage, especially when you're getting older. Your teeth are falling out.
Yeah.
You know, I mean, honestly,
Yeah.
you gotta be careful. I know, I would be thinking about that.
Dental costs are as
Huge.
expensive as medical costs.
Oh,
these
it's
days.
very expensive. Call them, this is a free service to you. Every day is a
It's a
Medicare
Medicare
day, and his phone number is 480-847-0701. He covers the entire Southwest. It is a free service to you. Call someone local, that's what he wants. Hang tight, we'll be back in just a minute.
Yeah.
I got a little tongue-tied there.
No, it's
So-
a live show.
I know.
Of course.
Only me. So, I want to go back to this in a sense, because then we're going to talk, if you want to talk about more dental and maybe you want to talk about eye. I don't know what you want to talk about.
Yeah,
Yeah?
we can go with the flow. Yeah, let's.
What else?
Hospital long-term care. People don't realize that Medicare doesn't cover long-term care, which is something if we need extra help, we can't live on our own as we get older or something.
Right, that's a big thing.
And those costs are exorbitant, and so there are plans to help that too. But you got to plan ahead. Like I said, you can't
Right.
wait till you
How
need
do you
it.
plan ahead for something like that?
Get the insurance, right?
You have to have the
I mean,
insurance.
or you have to have a lot of money in savings.
Yeah.
Because, I mean, think of it this way. You don't buy car insurance after a car wreck.
No,
Right.
but the question is, let's say
Yeah.
somebody is older and they don't have it.
Mm-hmm.
Do they still do it?
They possibly can. I mean, it depends on the
Okay.
person, and they've got to have money to be able to fund
Yeah.
that long-term care
Yeah.
insurance, because it's not cheap
I don't
either.
know why. I don't know why everyone doesn't just have that. To me, it would be important to have, because most people don't have the money.
Mhm.
I don't think so, anyway.
I mean, long-term care costs, I don't want to quote any costs necessarily, but they're thousands and thousands a month. I mean, 5 to
That's crazy.
8,000 a month. It could
Yeah.
be,
But they
depending on the
have
level
to
of
have
care.
it.
But I mean, yeah, that or just to look out the money sitting in an account somewhere,
I
right?
know.
Which is kind of what a long-term care insurance is.
Mhm.
You're just having someone else.
How do they get it? Do they get it do they have to like take a physical and all that kind of thing?
Depends on the plan. It's kind of modeled after life insurance, actually.
Okay.
So it's kind of through life insurance companies instead of health insurance companies, because they're hedging against a long-term, hopefully down the road
Mhm.
thing. Obviously, it's a little harder to buy long-term care the day before you're going into a facility,
Obviously,
right?
yeah.
But we want to
Be
plan for that a
prepared.
little earlier.
Being prepared.
Yeah. That's why I like to use the car thing. It's because everybody's used to buying car insurance, but not everybody's used to buying all these other insurances.
Yeah.
And I am not suggesting being overinsured, because that's silly. I mean,
But
why would we want to just sell somebody a bunch of
Right.
different stuff?
But
that
it
they're
does
never
seem to me like layering.
Exactly. Yeah.
Layering, just to have it for,
Yeah.
I mean, especially for seniors, they all wear glasses,
Mhm.
right?
We all need teeth. We all need teeth care, no matter
And
how
I
old
can't
we are.
believe it doesn't cover teeth cleaning.
Yeah.
That is like the first thing you do,
Yeah.
right?
Yeah. Or you should. Yeah.
So if
Uh-oh.
it
Gotcha.
doesn't cover that, that's crazy.
Yeah.
You need it. Here I come.
We're back.
Let you
I'll take
go.
over the show.
Do it.
Yeah.
I'm losing it, folks. Okay.
Obviously, we're having fun here.
We are.
Yeah.
I'm not even now. It's just terrible. Anyway, all right. I'm doing pretty good though. You have to admit.
Doing great.
I know. Thank you.
For your first time on the show, you're doing great.
Thank you. I want to talk about something that we were talking on at the break, and this is about being prepared. Biggest thing, and a lot of people, I guess they probably don't even think about it until they have to with this too.
Yeah.
You were talking about that they need long-term care, possibly.
There's possibly, a lot of us, myself, I come from a small family. I don't have a bunch of kids that take care of me. We have one daughter that lives in another state, and she doesn't want to come to Arizona, and I don't know if I want to live year-round where she lives, so, unless you have a big family to help take care of you or something like that, there's the possibility of you not being able to take care of yourself or live in your own home after a certain extent, and that's called long-term care. Medicare doesn't necessarily cover long-term care in a facility or something like that. So we're talking about you used the term
Layering.
perfectly earlier, layering insurances. Again, like I said in the break, we're not trying to suggest that you should be overinsured. We're just trying to give you some tools to feel comfortable and to plan for the future, right?
Well, think about this, right? As we get older, number one, we talked about our teeth,
Yep.
right?
Yep.
Number two, talk about your eyes.
Yeah.
Most every senior, you're gonna have to have, an eye exam.
Mhm.
You do have to take care of yourself.
Yeah.
And people think that it's all covered,
Yeah.
and if it's not, you have to have this layering effect of
Yeah.
getting certain things. How does it work when they, let's say they can have just dental, maybe not
Mhm.
eye, or do they come in a pack? How does it
No,
work?
you can get just dental. If you have a family history of 20/20 vision, and until people,
You're lucky.
Yeah, right. You may not, but so you can buy insurances to suit your needs. So dental insurance, vision insurance. You can also buy a dental vision combo insurance. Long-term care is a separate product. Hospital indemnity for those hospital costs, because hospital costs are a big one as we age, or could be a big one
They're
as we age.
huge.
And again, it's all about education. Not all these things may fit for you as you're driving your car, you're sitting listening to this show, but one of them might be, something that you need or you look at in the future. And that's what we're looking at. We just want to make sure that you have a comfort level with your coverages and your insurances as you age and as you progress through life. As I said during the break, we all buy car insurance for our cars, not because we plan on getting into an accident, of course, knock on wood, but because it could happen, and who the heck can afford to buy a brand new car if you're still trying to pay off your old one because you get in an accident, right?
Exactly.
So that's what insurance is for. Same thing with our medical costs and things like that. So again, for small amounts monthly, it can protect you or help you pay for those things that could be larger in the future. You're still paying a premium for some of these insurances, but again, it's a bite-sized manageable piece versus a big bill that comes in all at once.
Yeah, and I think that people, they put their heads in the sand when it comes to certain things.
It's hard. We've talked about this over the years a lot of times, because we work for an employer that gives us insurance, or they pay for part of it, or maybe most of it, or some, if you're lucky enough, they may pay for all of your insurance. But when you look at that health insurance, a lot of times it doesn't cover dental either. You have a separate dental plan with your employer. You have a separate life insurance plan with your employer. You have a separate, this stuff. It's the same with Medicare. This is nothing that is earth-shattering and different. It's just that people aren't used to looking at it all on their own. They're used to an employer telling them what they offer, and then you pick what you want based on how much you want coming out of your paycheck.
Yeah. Now, I'm going to want to talk about husband and wives, or couples, right? Because, you might be on your husband's or wife's insurance, right? But sometimes when you look at it as you're turning 65, it might be better for you to not be on that.
Yeah.
Go ahead.
That's a really good point. We've kind of talked about this in the past a little bit, but we are looking at insurance costs rising, right? And they rise for your employer too. So when you turn 65, you may still qualify for your employer insurance, or your wife or your husband that is on your employer insurance, but that usually costs an arm and a leg when you're adding a spouse onto an insurance.
Really?
And so when you look at that, Medicare can sometimes lower those costs and give you as good, if not better, benefits. So even if you're still working, you might look at what the difference is between your employer group insurance and what Medicare would be. It's an interesting conversation, but oftentimes we find that people can save money and get as good, if not even a little better coverage sometimes. Just depends.
The phone number to call is 480-847-0701. He services the entire Southwest, and this is a free service to you. What I love about you, Michael, is it's all about making sure that your client totally understands what they're doing. It is a complete educational approach.
Yeah, it really is. I mean, you're not going to get the most out of your benefits that you have with any insurance, with anything, unless you know what they are and how to use them.
And how to use it.
Yeah.
That's big.
It sounds great, these advertisements on TV that say you get this and this and this and this, but if you forget about it 10 minutes after you enroll, or whatever, that's not helping you to utilize those benefits and get the most out of that insurance that you may or may not be paying for.
Mm-hmm.
It's the same on anything. So make sure that you understand your benefits, and that's what we're here for.
Yeah, when it comes to prescription drugs, I mean,
Mhm.
this is the biggest thing that seniors have to deal with the most, right? And what happens when, they might get a medication that is really expensive?
Yeah. So it depends. If you had an election period to change your insurance plan, if need be, you could do that. But again, not everybody has that opportunity during the year. Sometimes we're locked into a plan. But there are safeguards in the Medicare insurance. There are a lot of really expensive drugs out there, don't get me wrong.
Oh, boy.
But Medicare, the Center for Medicare Services, put a cap on your covered drugs. So if the drug is covered by your insurance, even if they cover it and it's really expensive still, like $1,000 drug may still cost you $200 or $300.
Jeez.
The max out of pocket for the year is $2,100.
Okay.
Which is a lot of money, don't get me wrong. But you're not gonna spend $10,000 on drugs.
But
if
you
they're
could
covered
get there
drugs.
pretty fast.
With some prescriptions, I've seen prescriptions $4,000 or $5,000 a month
Oh,
sometimes.
yeah, I know.
Yeah. So, yes, but there are safeguards there. But yeah, we can always help somebody talk through that and look at the plan they're on and the drugs they're on, and just kind of help them reevaluate.
What is the number one question that you get asked?
Well, the number one question is, what's the best plan?
Right.
We get that all the time. And there's the short answer to that is it depends, right?
I love when people say that. Well, it depends.
But it's true, because your needs are different than your neighbor's needs. Your neighbor might have diabetes and you may be perfectly healthy, or vice versa, or whatever. So it really depends on the situation. And there are plans out there that I believe generally there's a fit for anybody. We have enough plans available. It just depends on what your needs are, what your financial abilities are, and things like that, and what you're planning for.
Yeah, well, I think that's a hard question to answer no matter what.
It is.
And it's going to be different for everyone.
It is, and that's what is so important about education, because when we're educating you about Medicare, we're also finding out about, you and what your needs are, and, do you take a lot of prescriptions? Do you have a history of diabetes or something like that may impact your costs drastically? There's just a lot of stuff that goes into it.
We've also mentioned this many times, and that is what your wife might have is going to be different than what you have. You could be on totally different insurances.
Yeah, it's a good point. We're used to, during our lifetime, going back again to our employer group insurance or our family insurance that we bought, when we're under 65. Everybody's on the same plan because that's what's offered, right? With Medicare, it's individualized. You, the family, you and your wife, or you and your partner don't have to be on the same plan. Each one of you can be on whatever plan's best for you. Now, we do find that a lot of times spouses are on the same plan just for convenience, but
it probably doesn't happen that often.
Yeah, could, I don't know.
Because everybody has a different something going on with them, right?
Sure.
I mean, your medications are probably not going to be the same.
No, I've been in situations where it tends to be that women are healthier than men. I'll just say it. I don't know. I'm mad about it all the time, but but
while I'm sick here.
Yeah. But I've been in appointments where the wife perfectly healthy and the husband is sitting in his recliner on oxygen. And so it's not always that we need the same things.
The one thing that you should know is that you need to be educated on this. And Medicare, they have made it so incredibly difficult.
There's just a lot of information, and it's a government program, so it's not easy to understand and interpret.
Of course. But the one thing that is we have Michael here. He's here to help. He services the entire Southwest. It is a free service to you. Call somebody local. That is what he says all of the time. His phone number to call, it's 480-847-0701. Woo-hoo! Oh, he's